Okay, Kevin. So it looks like we've had a couple questions come in while we were doing this. Well, I'll take the first one.
Okay.
Right. How often do you see OAB and BPH symptoms overlap in men? Although OAB is undertreated in men, it's common to see OAB in men with BPH. And men with OAB often present with an overlap of the LUTS symptoms as part of that. In fact, roughly 50% of men with LUTS report a combination of storage and voiding problems. So I think it's not uncommon to see symptoms of OAB and BPH overlapping, but typically the storage symptoms, frequency, urgency, urge, urinary incontinence, can be differentiated symptomatically from hesitancy, poor flow, feeling of incomplete emptying. So I think that as that whole LUTS thing, storage and emptying symptoms, you can focus, basically on how the patient's presenting. Some of the symptom scores are very good for looking at this. Why don't you take the next one?
Okay, so this is a pretty common question about what's the typical treatment for OAB and BPH in men. Well, typically, voiding symptoms associated with BPH are treated with alpha blockers, 5-alpha reductase inhibitors, or phosphodiesterase 5 inhibitors. In men that are also experiencing the storage problems associated with OAB, the treatment may involve behavioral, pharmacologic, or maybe even minimally invasive type treatments. Lifestyle changes and behavior therapies like fluid reduction and bladder training, they can also have a role and can be of some help. Clinicians may offer patients with OAB and BPH monotherapy with antimuscarinic antagonists, beta-3 agonists, or combination therapy with alpha blockers and antimuscarinic medication or a beta-3 agonist. Minimally invasive therapies like botulinum toxin, they can also be used.
It's interesting, and as you went through that very completely, I might add, the COURAGE study, specifically looked at one of those subgroups that you talked about. And these were men who were treated either with an alpha blocker with an ARI or an alpha blocker alone for symptoms of BPH, who had residual OAB symptoms, and then were treated with Gemtesa and placebo. So the study really did specifically look at a subgroup, a very large subgroup of the patients that you just mentioned. Okay, why don't I start with the third one? In the phase 3 COURAGE trial, had participants previously tried OAB medications, including beta-3 adrenergic agonists or anticholinergics? Again, a little bit of follow-up on the study. I know the answer to this one. 14.6% of the patients actually had previously tried anticholinergics, and only 5% had previously tried beta-3 agonists. The participants were required to withdraw from these medications and wash out in order to participate in the trial.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.